I can't believe this is actually a movie released years ago. In front of me, a bat holding a piece of banana flies into a pig farm. During its meal, a small piece of banana falls to the ground, and a piglet, after eating this piece, is soon selected by people and sent to a restaurant. The chef personally handles the suckling pig. At this moment, upon learning that a guest wants to see him, he casually wipes his hands on his apron and goes to the lobby to take a photo with the guest, involving physical contact. After the meal, the woman goes to a casino, but the Japanese man next to her tells her to blow a breath before placing a bet. The woman, full of luck, forgets to take her phone when leaving, and a kind Ukrainian beauty hands it back to her. After she leaves, a waiter collects the wine glass she used. When the woman returns home, the first thing she does is hug her son. However, the next day, the boy shows signs of fever. After the father brings the son back from school, the wife at home feels weak and soon collapses, convulsing uncontrollably. Although rushed to the hospital for treatment, her son also dies at home from the same symptoms. Meanwhile, the Ukrainian beauty also feels unwell, abandons her interview plans, and takes a taxi back to the hotel. When cleaning staff find her, the Ukrainian beauty has already become a corpse. The Japanese man on the bus also feels dizzy and slowly collapses to the ground. Nearby passengers, seeing this scene, gather to take photos and upload them online. At the same time, the waiter also starts showing signs of confusion and ultimately dies in a car accident. Her girlfriend, while returning her ashes to her hometown, also dies on the bus. Thus, an unknown virus begins spreading globally, with the number of infected rising exponentially. As the death toll soars, authorities finally take notice. After examining the brain tissues of patients, researchers find that the virus is something they've never seen before, with a high mortality rate. It spreads merely through breathing and contact. In just a few days, recorded cases reach 89,000. Given its high reproduction rate, if left uncontrolled, within a month, 1 billion people could be infected globally. To prevent this, the health department sets up makeshift hospitals to treat infected patients and isolates anyone who had close contact with them. To curb population movement, schools suspend classes, the military seals city exits, and the government urges citizens to stay at home and avoid contact with outsiders. During this time, an internet celebrity conspires with a pharmaceutical company to make a fortune. Using his influence, he claims online that after being infected, he took a medicine called Lianqiao, and after some time, his condition visibly improved. Terrified people start hoarding Lianqiao, but pharmacies cannot meet the demand. Frenzied individuals begin looting drugs, and supermarkets are emptied. The once bustling city resembles a wasteland, with looted shops everywhere and a surge in violent incidents due to scarce resources. Over time, the high number of deaths results in the depletion of body bags. Although the government distributes supplies for free, daily provisions cannot meet the demand. In a country where firearms are not strictly controlled, some people even break into others' homes at night to loot. At this point, researchers finally develop the first vaccine. However, it needs weeks of human trials and certification, potentially taking months to be available. To speed up vaccination, a researcher injects himself with the first dose and then visits his father's hospital room without a mask or glasses. This drastically shortens the vaccine release timeline. To avoid public unrest, the government devises a fair method, drawing lots to select a date, and everyone born on that day gets vaccinated first. As production scales up, the virus is gradually controlled and mitigated. The internet celebrity promoting Lianqiao is arrested. After examination, it turns out he was never infected. His actions were purely profit-driven. In the end, the health department traces the virus outbreak to its source. It turns out that deforestation caused bats to migrate, and one virus-carrying bat flew into the pig farm. The first infected woman was an employee of the logging company.